There's been a significant increase in whooping cough cases in Wisconsin. The State Department of Health Services has received reports of 625 confirmed cases compared to just 51 cases reported last year. Joining us to talk about this, it's Dr. Bill Hartman, the clinical trialist at UW Health. Doctor, great to see you. All right, let's talk whooping cough. That's 10 times as many cases as last year. What's going on here?
Right, and already this is happening at 10 times greater. And so it's really hard to say what's going on. We do expect cases to increase over time. Pertussis itself is going to mutate to make itself more effective. We have a different type of vaccine than we used, say, 10 or 15 years ago. But still, this number of increases, this 10 times greater number, is something that's very concerning.
I know this is really dangerous for infants. Why?
So infants especially have immature airways. And so they've got this inability to clear this bacteria, to clear this infection. The first vaccines should be given to babies sometime between 2 months and 5 years. They get a series of 5 vaccines in that time. They don't have that immunity. So the combination of the immature airways and this decreased immunity makes them very susceptible to an infection like pertussis.
Okay, so the state's kind of put out the warning here. I thought it was interesting. They were saying it was really kids 11 to, was it 18 that are in this group are really getting hit hard by this, but they would have received a vaccine, right? I mean, you get another vaccine when you're a little bit older, right? Not just a baby.
Right, and I wonder, as I look at these numbers, half of these cases are in this 11 to 18-year-old range. Did we miss a window of boostering these kids? They would have been vaccinated with their booster shot during the COVID years, and because of the shutdowns, because people were wary of vaccines at the time, and other vaccines were obviously all over the news, did we miss a window, and are these kids not as protected as they otherwise should be at this point?
Right, might be good to talk to your pediatrician, make sure your kid got that vaccine or if they need to get it. Hey, let's talk microplastics for a second here. They seem to be everywhere, and a new study says we may have tiny shards and fiber of plastic in our brain.
Right, so they looked at cadavers, and especially at the olfactory lobe, olfactory bulb, which is the part of the nose that interprets odors and sends the signals to the brain. It sits right at the base of the brain. And so with microplastics in this area, they can easily be transposed to other parts of the brain and the spinal cord. We don't know what the consequences of that are, but you can certainly imagine that it can cause some sort of inflammatory response that would be detrimental to either the brain or the spinal cord.
I hate this study because my wife thinks that my brain is just full of plastics, and now she's going to see this segment and know that she was right. Dr. Bill Hartman, very interesting topics today. Appreciate it.
Thank you.